Meet Client X, a 79-year-old woman who lives with her husband. She had a fall at home, resulting in a fracture of the first metatarsal on her right foot. Client X was initially given support from the Rapid Intervention team. However, after their 3 days of support, it was decided that Client X would benefit from further support and so was referred to the intermediate care team. The referral gave brief details of Client X and her current situation. It is known that Client X has good family support and that she had a total right knee replacement 6 months ago due to osteoarthritis. These are important factors to consider throughout the intervention. It is important to understand the context in which this intervention took place. Client X received support from the Intermediate Care Team, which is a nationally recognised service who provides support and rehabilitation to individuals who have been discharged from hospital and need to receive support at home. The Intermediate Care Team is made up of an occupational therapist, an assistant practitioner and rehabilitation support workers. The occupational therapist will complete the initial assessment and formulate an intervention plan based on individual needs and SMART goals. The assistant practitioner and rehabilitation support workers will implement the rehabilitation plan with clients. This service is underpinned by national legislation. The act most prevalent here is the Community Care Delayed Discharge Act 2003. This piece of legislation sets out the aims and objectives of the service, who provide a structured programme of care for a period of 6 weeks to anyone in need of the service who is 18 years and older. The main aim being to reduce unnecessarily long stays in hospital. As well as this, the service is governed by national guidelines such as those set out by the National Institute of Health and Care Excellence and the Occupational Therapy Code of Ethics and Professional Conduct. An initial assessment was completed with Client X at her home using a standardised assessment tool. The aim of the assessment is to gather information about Client X in her own home and assess her needs within this environment. Therefore, the main type of assessment was observational. This information would then formulate the basis on which to identify occupational performance needs and SMART goals for Client X. The main occupational needs for Client X were completing her personal activities of daily living and transfers and mobility. These included washing and dressing independently and safely mobilising around her home and in and out of a chair. It is important to consider all aspects of Client X, such as her physical, psychological, cognitive and interpersonal abilities, as, for Client X, a main area identified was anxiety and lack of confidence after experiencing a fall. SMART goals were completed based on the information gathered at the initial assessment and from the occupational performance needs identified. It was essential to work in a client-centred manner when identifying appropriate needs-focused goals for Client X, ensuring to develop and implement an individualised rehabilitation plan. The aim was for a rehabilitation support worker to implement this plan each morning for 1 week before being reviewed. This plan incorporated 4 SMART goals, which were to regain as much independence as possible with personal care needs within a 6-week period, to promote independence, choice and care with dignity during the personal care tasks, to improve and progress mobility within the same time period, and to return upstairs to sleep and wash within the 6 weeks. The intermediate care team review each client on a weekly basis. At this review, the occupational therapist, assistant practitioner and rehabilitation support workers discuss the progress of client X. After thorough handover and discussion of the implementation of the rehabilitation plan, it was clear that all of client X's occupational performance needs had improved. Here it was essential for interprofessional working to take place effectively, so as to continue to work in a client-centred manner and protect valuable service resources. In order for client X to progress further and complete her final SMART goal of returning upstairs to sleep and wash, she was asked to complete a stairs assessment with the occupational therapist and assistant practitioner. Once completed, client X was assessed as being able to safely use the stairs. Up until this point, client X had used the facilities downstairs to wash and dress, and was now asked if she would like to have a shower assessment, which was located upstairs, to ensure that she was safe and independent to do so. However, client X declined and asked to use her family support here. Working in a client-centred manner and based on professional reasoning, client X now had the opportunity to make informed decisions about her own care, and therefore it was decided to allow client X to use her family support here, and therefore was discharged from the service. The intermediate care team have a focused goal of supporting regained independence in the home. However, it is also acknowledged that client X is an occupational being, and that occupations such as leisure and productivity were not explored with client X. This was due to the specific nature of the intervention provided by the service. Client X achieved all her SMART goals and improved all her occupational performance needs, meaning she remained living at home with her husband independently, which is the overall aim of the service.